979 1055 KISS FM. It is Listen, it's Liz. And on the phone right now, I have Dr. Eadline from Slocum Dickson at Medical Group. Good morning. How are you?
Hi. How's everyone there?
We're doing good. You know, we're trying to stay home and wash our hands like you guys have been telling us to do. And right now at Slocum Dickson Medical Group, what has been going on and what are you guys doing?
Well, overall, what we're trying to do is ensure the health and safety of our patients and our staff. For those patients that have been to our group in the last week or so, you've noticed that we have temperature check stations to get into the building. We're trying to screen everyone to make sure that they have a low temperature and don't exhibit any symptoms. We've been cutting back on the types of visits we're doing. Non-essential visits have been put off for 4 to 6 weeks, and we're doing a lot of phone triage with our sick patients to make sure they're staying safe at home, but also checking in with us to make sure that they're not getting worse.
Yeah, it's all very important, all of these steps that you're taking to make sure that not only the patients are being taken care of, but obviously doctors and nurses. And when it comes to this telehealth, what exactly is that for those who do not know?
Well, about 6 months ago, telehealth was available and was out there, but you didn't hear about it very much. And it's been coming on more and more for rural medicine where a doctor or a nurse is not easily accessible. But obviously, in the last 6 weeks, it's all we hear about.
Yeah.
So telehealth is a way to have a video conference with your physician to discuss questions and health concerns, and sometimes maybe even making a diagnosis so that the patient can be taken care of. But it's a way to also screen and to make sure that patients are doing well and that everything is going okay.
Yeah.
It's a little bit complicated in that we have to have some software set up. And we have a pretty easy platform that we're using at Slocum Dickson. There's directions on our website about using it, and I've done a few of these, and it's worked pretty well for an older physician that's not really tech savvy. Even I can do it. Parents have been ecstatic about doing it because they get to stay home. We get to have a discussion. We keep contact, and it's working out very well. Not for every visit, but for most visits.
So what type of visits benefit from having this telehealth at Slocum Dickson Medical Group?
Well, I think it's easier to think about what's not going to work. We can't do a physical exam.
Right.
So if someone comes in with an earache, everybody knows you have to look in the ear to see what's going on. So we haven't gotten past that yet. Now, there's technology out there to eventually work on that, but for right now, it's not going to happen. Sore throats, you can look in someone's mouth on the computer, but it's not always a good picture, good resolution. But where it works very well is for patients to be able to go over their symptoms and discuss what's happening and maybe make a decision, well, I think you can stay home a few more days, or maybe you need to come see me now because I don't like what I'm hearing.
Right.
Where it's actually worked well for me and for other providers in our group are what we call medication checkups, where we just want to make sure people are doing well on their medication.
Yeah.
We don't do vital signs, but just to make sure that medication that was started or continuing is going well. And then also mental health checks are very easy to do, and it seems to put the patients more at ease to be able to do them from home.
Yeah.
And that's been working very well.
Yeah, it's very cool to see that now you can basically FaceTime with your doctor and be able to communicate that way in 2020 is huge. It's Slocum Dickson Medical Group, sdmg.com for more information about telehealth, their Facebook, their Twitter. You guys are keeping us up to date with everything that's been going on, and it's been very calming to be able to look online and see what you guys have been saying and doing to make sure that we're staying safe and as well as you guys.
Well, thanks, Liz.
Yeah.
This is weird not being there talking to you, but it's still nice that you're doing this and getting this information out. I appreciate it.
Yes, of course. It's very important. We want our listeners to be as safe and as healthy. So if you want more details about Slocum Dickson and how you can stay safe during this time, make sure you are heading over to our website, cnykiss.com, or to sdmg.com for more information. Dr. Eadline, thank you so much for calling me this morning. I do truly appreciate it.
You're welcome.
Yes, and it's good to talk to somebody else and somebody new. So,
Okay.
so make sure you're getting more details about Slocum Dickson Medical Group, sdmg.com for more information.